One of the common questions we get asked frequently is, what do you think about poison ivy allergy? And a lot of people are, concerned about um, coming in contact with poison ivy as we start going through the spring season and through the summertime. Um, Poison ivy is an allergy. It affects about 85% of people. It's something that somebody can develop, so you don't have to be allergic to it to begin with, but you can certainly develop that allergy. Similarly, there are people who have strong reactions to poison ivy and then become non allergic, although that's not very common. Uh, the type of allergy with poison ivy, however, is very different than allergy to, let's say, grass or trees. Um, the allergy to poison ivy is related to the oil of the plant, and it's mainly a contact allergy, so it affects the skin. And symptoms can occur almost within few minutes from contact, but can be delayed as much as 48 to 72 hours or longer. Um, eh, People also have the misconception about poison ivy being contagious. It's not. What it is you can get cross contamination where an area where the small amount of the oil came in contact with the garden tools or gloves or skin, but get transferred to other parts of the body. Um, just remember that if certain tools are contaminated with the oil, that oil is going to stay on them until it is washed with some kind of a detergent or soap to remove the oil, just like any other oil. So merely getting it wet may not be enough to remove it. Another thing to keep in mind is if you realize you've come in contact with poison ivy, then um, it is highly recommended that you immediately wash that area with soap and water. You have what is might be a very limited grace period, or maybe a couple of minutes, where if you can remove that oil from the skin, then you might significantly reduce the amount of reactions that you may have. Beyond 5 to 10 minutes, even if you wash it off, the reaction process has started and it's unlikely to make any effect other than preventing it from spreading to other areas. Uh, the other thing to keep in mind is poison ivy is not life threatening. It is extremely uncomfortable. It can give you extreme discomfort and itching, and can last for days to weeks at times, and can make your life miserable. But it's not gonna kill you unless you really eat it and you get swelling inside your airways that blocks the breathing. But it's extremely unlikely that anybody does that. So treatment is different than, say, somebody who has an anaphylactic reaction to food allergy or to bee sting allergy, where epinephrine is the mainstay of treatment. In the case of poison ivy, epinephrine is really not used. As I said, it's not gonna affect um, the type of reaction that occurs with poison ivy. So the next step after avoidance and washing any exposure would be to start treatments with antihistamine for the itching, use of topical corticosteroids to help reduce the inflammatory process, as well as in many cases you will need to use oral prednisone or an injection of corticosteroids of some sort. Realizing also that corticosteroids do not work immediately. Um, the earliest you can expect any effect from corticosteroids is 6 hours following administration, whether it's oral or by injection. And it will take at least 24 hours to see real true effect. That's why it's important many times to take them over, few days or maybe a couple of weeks.